Welcome back to Driven by Dreams. Today, I'm excited to introduce a founder who made an unexpected but powerful leap into entrepreneurship. Lauren Fang, the president and co-founder of MedAssent DDS, was on a path to medical school when she pivoted to tackle a critical gap in dental care. With a background in biotech, clinical research, and strategy, she's now leading the charge to end smile denial, ensuring safer, more efficient medication management for providers and patients alike. Hi, Lauren.
Hi, Anishka.
Thank you so much for connecting with me today, and I'm really looking forward to learning about your journey.
Well, thank you so much for inviting me. I feel very honored and looking forward to our conversation.
So, to start it off, could you share a bit about yourself?
Sure. My name's Lauren. I am the co-founder and president of MedAssent DDS. We are basically a digital health startup in the digital dentistry space and founded it about 2 years ago now. Time flies. We just launched last spring. Happy to talk more about what we actually do later on, but very exciting. I'm pretty young, graduated a couple years ago from UCSD and sort of did a whole deep dive into the world of entrepreneurship. So a lot of growing, a lot of learning, and it's been a really great journey so far.
Nice. So, how did you find out that you wanted to be an entrepreneur?
Honestly, for me, it was sort of a circuitous route. Like, I never thought growing up that I would go into entrepreneurship or business. Like, that was just never something I thought about. To be honest, I was like on this path for medical school ever since I was little, as doing all the activities during high school and then college. I was pre-med. I studied bioengineering, biotech, and I also did pre-med volunteering, did a ton of research. And so that was sort of my path, and was really committed to that until, I would say, actually my senior year of college. I took an organizational management class. I think that's what it was called at UCSD. It was like my last quarter, and I was like, let me just take this for fun. And it was really great. I really enjoyed it. And shortly after graduating, 2020, pandemic hit, I was still doing research down at UCSD. But I also started working at a digital health startup called MedAssent. So sort of the predecessor of MedAssent DDS, which I'm working on now. And, really, really great team. What we were doing there was basically helping patients understand how to take their medications properly. So going through whether it's the health system or what we ended up actually doing is going through a lot of mental health and substance use facilities and really breaking down all digital format, how to, use the medication, what do you need to know, AI chatbots so people can ask their questions, instructional videos done by Disney and Pixar artists, and a lot of other really cool features. And I just really enjoyed seeing this other side of, because it is still connected to medicine, right? But it's a way of helping people in a totally different way than, one-on-one. So I was just doing some really basic, project management work for them and applying for medical school at the same time, taking my MCATs, applied a few cycles. And ultimately, I don't know, it was just, I really fell in love with the work that we were doing and being able to create something and talk with people and figure out like how we can make their lives better. And also the community. And somehow it was a really, really tough personal decision. But in the spring of 2022, basically decided to withdraw my medical school applications while they were still, I had interviews and everything, and go full time, quit my lab, which I've been doing for 6-7 years. So it was a really big decision. And yeah, went full time with no pay, still no pay, but it's been a really rewarding and like I said earlier, just really learned a lot about myself and I don't really regret my decision.
Well, that's amazing. So, what's the biggest mental shift you had when you withdrew your medical school applications to going to the startup world?
Biggest mental shift, I think, was being comfortable, still not super comfortable, but with the uncertainty. Because, I forgot to mention a little bit, but my now husband is in medicine. So during that time, I was watching him go through medical school, and now he's in his residency, and I saw that path and really thought about what aligned with my, you know, ambitions or like goals for the future, and was like, I don't really need to go through 8 extra years to help people and do things and create things, which I did enjoy, obviously being an engineer. So that aside, yeah, so that biggest mind shift was like being on that track for so long and being like, yes, I'm gonna do my school. I'm ticking off all the boxes, just gotta do the extracurriculars, gotta do volunteering. I don't know, found a freaking nonprofit. I don't even know. I did all that. And for what? At the end of the day, I still decided to take this risk without a clear path forward, I guess, besides let me just like try it and see what happens. And like, I feel like every day things are just like something else is happening, right? Something new. You have to overcome another hurdle or overcome another rejection. Yeah, so that's been the greatest like mental challenge, is like learning how to deal with that and the uncertainty of entrepreneurship.
Well, thank you for sharing that. So, how did your background in clinical research and bioengineering influence the way you approached building medicine?
Yeah, so I think maybe here's a really good time to talk a little bit more about what MedAssent DDS does, to better answer your question. So MedAssent DDS, as you can see, a lot of our roots are in providing medication information. But we saw as founders, both of my parents are dentists. I grew up surrounded by dentistry. One of my co-founders, Dr. Lisa Chan, she's also a dentist for 35 years, so very, very experienced. And we're spending all this time working with medication information, and it was sort of staring at us in the face, like in dentistry, all the time you have to examine patients who are taking medications, sometimes really complex regimens, and dental professionals don't really have the tools available to them in a way that makes sense for the modern dental workflow. I mean, if you think about how many patients are on meds, how complicated they can be, and again, all the tools that are out there are either built for general medicine, so the dentist, they don't need to know is this, how to write something for pneumonia. They're not going to be treating that. They need that for a dental infection, or need to know if they can give local anesthetics and the very specific ones that they're giving. None of that information was available in a really fast format, and what ended up happening was a lot of patients were getting hurt because dentists or other dental professionals would just kind of skip over that stuff. We call it like playing roulette, and it's the honest truth. A lot of dental professionals don't like talking about it because they think it's never going to happen to them. But we see it from both ends. From, Lisa consults for the California State Dental Board. We see it in our daily practice. There's a lot of potential landmines that can be hidden with medications. So we took it upon ourselves and we built first a proprietary database of over 13,000 FDA-approved medications. That database tailored for dentistry. So all bullet points, what the dental provider actually needs to know. And then we built the software component on top of that to actually make sense for dental practices. And we're actually the first to make it so that this medication information is patient-centric. So instead of having to look things up one at a time, We deliver the information as like a single report for that patient. So you can see, what you can or can't do really, really fast, including dosing directions if you're going to be prescribing, drug interaction checks, everything all in one place. And we actually just submitted our provisional patent for the next version, which is like the AI, which is really cool, just taking that and processing that again, making it just much more efficient for dental providers. And so to answer your question about how did my background help with that, I would say that in general, I have a very analytic mind, like, scientific process. And definitely the ability to pick things up pretty quickly and be hands-on where I need to. So things like learning how to code, which I know anyone can do, but at least that was something I was able to do more quickly because of the background that I had, where if we're short on hands for getting some project out, okay, let me just learn how to do C# real quick, or code the front end. And then in general, I think, just being able to think sort of at that analytical level again, crunching the numbers for our financial models, doing math. But then again, I always say, I studied so hard. I'm not using my degree for anything. I'm doing Canva. I'm designing things. So I guess no matter what, it's always going to be a learning experience. I had to learn so much and do all this stuff that I never learned during college.
Well, it sounds like you do a lot of things as a part of your business. So what's your favorite part?
What's my favorite part? I would say two totally separate things. So one, I just really like building things. So that's sort of the tinker mode of okay, how can we improve this thing? Or how can I just learn to build this app? And that's, number one, enjoying building things. Number two, I honestly has been sort of on the marketing side. So after we launched, one of the things for the industry that we're in, it's very popular, is going to the trade shows or basically they're different dental conferences. We're going to 2 next month. And that has been really fun because I enjoy traveling. It's definitely a logistical hassle because you have to ship things and, we're super cash strapped. So we just are very, very creative, just put it that way, in the ways that we figure out how to get things places and and design our booths and things. It's been really fun to actually just talk to people at these different conferences. One of our team members has a therapy dog, so we'll bring her therapy dog to our conferences. It's just fun. It attracts a crowd, get to talk with a lot of people, obviously get feedback on the program and start conversations. So, yeah, that's been the most rewarding aspect.
That's great. Well, beyond your company, what broader changes do you hope to see in the entrepreneurial or healthcare space?
I think in the entrepreneurial space, in general, I'm sure many women before on this podcast have said the whole gap in the funding between the money that's available versus what actually ends up going to female founders. Our team is female founded. We're 60% female, 80% people of color. I don't even remember the number, 30% LGBTQ. I don't even know at this point. We're very diverse on paper. And there's certainly times where you run into situations where that kind of works against you. That said, I think that the dialogue is starting to shift. I think people are becoming more willing to talk about those things in the venture space. So I'm excited to see where that goes. I was part of the women's fast pitch through Women's Venture Summit and Stella, and they're a really amazing organization. I think it's finding those groups of people, of women who are really trying to change the industry. That's been awesome. And so I hope to see a lot more of that down the line. In terms of healthcare, I mean, there's a lot of problems that need fixing. Obviously, like me personally, I'm still, sort of operating on the fringes as a third party. Like, we can see the problems that exist and we can solve one thing at a time, right? And produce and have one service at a time in a very fragmented way. It's such a I don't even know the words, Herculean task to solve the healthcare system. And obviously, the way things are going right now, we don't know how the shape of things in the next couple of years. For our two companies, learned a lot through first MedAssent RX, they're separate companies, but learned a lot about Medicare, Medicaid reimbursement, how people are actually getting care delivered to them. And then also from this other side, dentistry is completely different. And I have experience with that too, obviously working with my parents and working with patients and billing and all insurance firsthand. Night and day, really, and they both suck. And so there's a lot of delivery of care that needs to be fixed. A lot of ways that we can improve education and bring people up from the bottom up. Working a lot with more vulnerable populations, so doing a lot of work with those facing homelessness, whether that's through the Salvation Army, which was one of our main clients, through a lot of other free clinics. We're not a nonprofit, but there's a lot of work to be done, and it's very rewarding to work with these people who are often overlooked in society, and looking at cost breakdowns. That's where a lot of the times you're seeing emergency visits racking up costs and things. So there's a lot of work to be done in health equity.
Well, thank you so much for sharing your view on what's happening. How do you think the evolution of AI and other innovations is going to change this field?
I mean, I think we're waiting to see in terms of what kind of regulations are going to come down the line for AI. Right now, it's not necessarily regulated. As I mentioned earlier, we are doing some things in AI, pretty simple things, and obviously very guardrailed, constrained solely to our database, and being very careful, not sharing patient information with it. We're seeing a lot of areas where AI is making communication faster and easier, making people's jobs faster and easier. I mean, I think it's really exciting. I love my ChatGPT. It helps me so much. But I think that there's a lot of trust that needs to be gained in terms of from the provider's perspectives, if we're talking healthcare. How do you know that it's giving you the right answer, first of all? How do you know it's telling the patients the right things on the flip side? But a lot of really mundane tasks like insurance claims, or I don't even know, charting, like that's really awesome stuff. I see a lot of really cool companies working in those spaces. Yeah, I mean, we're just seeing the tip of the iceberg now.
Well, what advice would you give to other young entrepreneurs, especially those who don't come from a traditional business background?
Yeah, I would say in general, gosh, I don't know one person to take advice from. I don't even know what I'm doing half the time, it feels like. But I think really just getting out there and learning, and not being afraid to have questions and ask others about them. Had a lot of help from people in my life. Actually, one thing that was really helpful was going back down to UCSD and doing this in the Radi Accelerator. And that was when I was first starting out, and that helped tremendously. Like, it's like you don't know what you don't know in general. So you can only grow. You can only do that by trying. And doing a lot of different things that you don't know if you're doing correct half the time, right? Yeah, I'm not even really sure. Just taking risks and standing up for what you think is the right decisions.
Well, thank you so much, Lauren. Your journey is really inspiring, and I've gained a lot from your experiences. So, do you have any last thoughts or advice you'd like to share?
I think that in general, I have found it, maybe that's just me, but learning to be vulnerable with other people, admitting when you don't know something. It's something that I found especially how do I put it? I found that finding communities who are more willing to talk on a more human level, fellow entrepreneurs, I'm saying, finding that is really helpful because there's a lot of imposter syndrome, a lot of feeling like what you're not doing is the right thing, or you don't know what the heck you're doing. You're not showing enough traction fast enough, for instance, or you can't close around, or like just so many questions that you don't even know how to start answering. And I think sometimes it's hard to, be honest with other people because they're trying to put up a show of like, because that's the thing though. I feel like a lot of entrepreneurship or VC in general, the culture is like projecting. And so I think that's something that I would like to see a little different going forward. I like when we're able to talk about our difficulties so that we can help each other, and be honest.
Well, thank you for being here and sharing your incredible story.
Thank you so much, Anishka. It was so great talking with you.